the budget in Albany. We took I took a couple of minutes to break free from our negotiations to talk about two things. One of the things, obviously, on everyone's mind and what's happening in the world and in New York is this pandemic of coronavirus. And there's a lot of misinformation out there. There's a lot of false narratives that are going out, even within my family, even within people that I know, even within my staff, even myself. So one thing that's very important is to make sure that we are properly educated with respect to what's going on, with respect to this virus and this disease, this pandemic that's happening in New York City. And New York City is doing a lot with respect to this. So today you're going to hear from one of our city's leading experts. Another thing that the second part of this is we're going to hear from the Deputy Chancellor from Department of Education to talk about what we're doing and how the Department of Education is still, how we're still educating over 1 million kids in New York City, what that process is like, what it's like for distance learning, how we're continuing to feed our, the children that are, that need to be fed, and what we're doing. But first, let's start off learning about what this thing is, what we call COVID-19, what's going on with this coronavirus, what it is, and make sure that and how to deal with it properly, and the different things that New York City is doing. So we have Dr. Jennifer Rosen, who's with the Department of Mental Health and Hygiene, and she is been working who's an expert in infectious diseases, and has done research on this. And one of the first things I want to start off with Dr. Rosen is, what is coronavirus?
Sure. Okay, well, thanks so much for having me here today. Coronavirus, or the novel COVID-19 virus, is a respiratory virus that can cause symptoms including fever, cough, sore throat, and shortness of breath. Most people recover fully and have mild illness, but people who are most at risk for severe illness include adults over the age of 50 and people with underlying health conditions, for example, chronic lung disease, chronic heart disease, diabetes, cancer, or people with a weakened immune system. There have been over 40,000 cases of coronavirus in New York City, and cases have occurred in all boroughs. But we also know that these are just the cases that we know about. This is an underestimate. There are many more cases out there among people who haven't been tested. Most of the cases have been adults, and there have been over 900 deaths to date. There's widespread community transmission of COVID-19 in New York City, and what that means is that the virus is circulating throughout the city, and we should all act as if we've all been exposed. So if you have symptoms of COVID-19, then you should assume that you have it, and that means that you should stay home and away from other people. So if you have mild illness, stay home. You don't need to be tested. You should stay home and away from other people. And you should stay home for 7 days after the symptoms begin, and 3 days after you are fever-free without the use of medicine to lower the fever. If you're very sick, of course, you should seek medical care just as you always would. For example, if you have shortness of breath, you need to seek medical care right away. But whenever possible, notify the medical facility before you arrive that you might have coronavirus so that they can isolate you appropriately so that you don't expose other people. In New York City, testing for COVID-19 should be reserved for people who are hospitalized. And that's for several reasons. One is, if you have mild illness, knowing that getting a test and knowing the results won't change anything. Your doctor is just going to tell you to stay home regardless of what the test result shows. Also, if you go to an outpatient setting when you don't really need medical care, you're both exposing other people potentially, but also you yourself could be exposed to other people who may be infected. And finally, the other reason not to do testing for people who are not hospitalized is that the extra testing uses up the supplies that are needed, which are limited, but needed for testing of hospitalized cases. Generalized guidance for COVID-19 is on the Department of Health website, but to review briefly, Governor Cuomo has extended in-person workforce restrictions, which have been implemented through various executive orders until April 15th. Essential services will still remain open, so things like pharmacies, convenience stores, grocery stores, gas stations, laundromats, banks, and mass transit will remain open. And the full list is on the New York State website. Unless you are exempted, people should work from home, study from home, and avoid all unnecessary interactions and events. Really, you should just be leaving home for necessities like groceries, medical care, and exercise that you can do alone outside away from other people.
Dr. Rosen.
Yeah.
So, dumb question.
Mm-hmm.
Can young children contract COVID? Can they contract coronavirus?
Yes, anybody can contract the virus, but fortunately, the vast majority of serious cases, so the vast majority of deaths have been in adults. So although anyone can get it, you're at much higher risk for having severe complications if you are older.
Now, what are some of the symptoms that people should be worried about if they may get coronavirus? What are some of those symptoms?
Sure. So common symptoms would include fever, cough, sore throat, shortness of breath. Unfortunately, a lot of the symptoms are not specific to COVID-19. These are the same symptoms that people get when they have the flu or many other different types of respiratory viruses. So the important thing to know is if your symptoms are mild and you don't need medical care, just stay home. But just as with flu or any other condition that can be severe, if you develop something serious like shortness of breath, then it's important to seek medical care right away.
Now, folks have said that people with compromised immunodiseases are vulnerable. What are compromised immunodiseases?
So usually people will know so an immunocompromising condition is something that weakens your immune system. And people who have weakened immune systems would know that from their medical providers. So for example, people who have cancer and are receiving chemotherapy or radiation, they may have weakened immune systems. People with AIDS would have weakened immune systems. And certain medications weaken your immune system. But
okay.
And typically if someone's on a medication like that, their medical provider would have told them that this is a medicine that would weaken your immune system.
All right. So now how does this COVID-19, how is it transmitted?
The most common way it's spread is by respiratory droplets. So the primary way it's spread is person to person. When two people are within a few feet of each other, so usually we say about within 6 feet of each other, and one person who's infected coughs or sneezes near the other person. It's possible that there may be some ability to spread the virus if the virus is on a surface and then somebody touches the surface and then touches their mouth or their nose, but that's not the primary way that it would spread.
So if someone has a nose or sneezing in their hand and they touch another surface, can that virus transfer onto that surface? Is that how that is? Is that what we're afraid of also?
It is possible, that it will be spread that way. But again, the primary way that it's spread is thought to be person to person when two people are within 6 feet of each other. And that's why it's so incredibly important to practice social distancing. So staying home. If you're sick, stay home, but if you're healthy, stay home. And if you go outside to get exercise, stay at least 6 feet away from other people.
So one of the things we were talking about is before was the social distancing, the 6 feet. Now, why is 6 feet the amount of space that they're telling us to stay away from folks for?
That's because with respiratory droplets, so things that are spread by respiratory droplets include things like coronavirus or the flu or the common colds. These particles are, they don't spread long distances through the air. They typically would not spread more than 6 feet away. And that's why we say to maintain at least 6 feet from other people.
So the governor spoke about the potential test of having a different kind of test. And a couple of weeks ago, actually, last week or 2 weeks ago, I think I got tested. I went and got tested because I had exposure to someone that had coronavirus, and thank goodness it was negative at that time. Who knows if I have it now? And the test was a long swab that was put into my sinuses. It was kind of uncomfortable, to say the least. Could you explain the test, and could you explain that if there are going to be any other forms of tests?
Sure. So the test that's currently being used is it's called PCR testing, and it uses a swab like you described, which is basically like a long Q-tip, and it goes into the nose, and that's how the virus is detected. And so that is the main test that's being used, and the only test for diagnosis in use at this time. Researchers are working on a blood test that can also be used to detect the virus. But that test would probably never replace the swab test. It would just be a test that might in the future be done in addition to the swab. And that's a blood test that, if developed in the future, would detect people's antibodies in their blood.
Dr. Rosen, a practical question. Someone that is sick in a home, so many people, don't live alone. Many people live with people and, have small spaces or what have you. How, if you live in a 1-bedroom apartment with someone who is sick, how do you, they're not extras, they have mild symptoms or what have you. How should they conduct themselves?
So we still recommend that people try to do social distancing in their home if they're sick, which is really hard. We live in city apartments, and many of us don't have a lot of space, but to whatever extent it's possible, if the sick person can be in a separate room, that's recommended.
Tell me about how, I see a lot of people in the streets nowadays wearing masks. Is that recommended? Wearing masks and sometimes gloves, is that recommended?
Masks are recommended for people who are sick if your medical provider instructs you to wear one. Beyond that, masks are just recommended in healthcare settings. There is no recommendation for the general public to wear masks. But there's no harm in, there's not harm in people wearing masks. Some people wear masks for other reasons too, like allergies or for air pollution. And so it's important not to ever stigmatize someone for wearing a mask, but there is no recommendation at this time for the general public to wear a mask. If you are sick, you should stay home. And even if you're not sick, again, you should be staying home and maintaining that distance of at least 6 feet if you have to go out to do necessary events.
So now, Dr. Rosen, for the over 80% of the people that are going to contract coronavirus and overcome it, are they immune to it moving forward?
So that's a great question. We don't know that answer yet, and there are studies being done now to look at that. We hope that that's the case, but it may be possible that it's similar to flu in that there may be some immunity that would last for a season. We just don't know the answer to that yet. And also to clarify, 80% of cases will be mild. Much more than that will recover. We don't expect, we expect a relatively small percent of people to die. But when you have a virus that can infect so many people, even a small percent can mean a lot of people.
Wow. Well, Dr. Rosen, listen, we know that you're super busy. We love the fact that we have such smart people like you working on this in New York City and New York State. We have some of the best minds working, on this. Any final last words for our viewers about coronavirus and what New York City is doing?
I do want to just reinforce the message that you said, that there's a lot of misinformation out there. And so it's really important to get your information from trusted sources like the New York City Department of Health website or the CDC website. And this is a very rapidly evolving situation. So check the website frequently for updates as things are continually changing. And lastly, I just want to remind everybody to take care of yourself and your family. This is a stressful time for a lot of people. If you're feeling anxious, stressed, or overwhelmed, you can connect with trained counselors at NYC Well, which is New York City's 24/7 confidential helpline, where you can be connected with a counselor. And to do so, you can call 888-NYC-WELL to speak with someone, or you can text the word WELL, WELL, to the number 65173. So thanks so much.
Thank you for being here. Thanks a lot, Dr. Rosen. Next, we're going to talk about education. There has been a big conversation about, when it came around, when we first were dealing with coronavirus, with whether we're going to keep the schools open, whether the Department of Education can handle distance learning, how we're going to deal with it. And New York City Department of Education is one of the biggest Department of Education in the country, educating over 1 million of our bright scholars. So today we are very excited to have the acting Deputy Chancellor for Community Empowerment for the Department of Education, Ms. Adrienne Austin, who she leads the DOE's work to empower families and communities while increasing the public's understanding of key policies with the Department of Education. And I'm going to ask her, the first question is, how are we dealing with this distance learning? I know a little bit because I have a couple of my nieces and nephews that are, I'll tell you guys a little story. I have my goddaughter, who is my niece, who is 3 years old, and she is distance learning, and it is amazing to see what's going on. Deputy Chancellor, tell us about this.
Thank you, Assemblyman Bunnell, for organizing the virtual town hall. Thank you to those of you that are joining us online. Yes, we launched remote learning last week. It was an amazing success. You mentioned the size of our school system. Yes, over 1.1 million students, over 150,000 employees. And so this was a monumental accomplishment for us, considering that we had such a short period of time to really get it off the ground. So thank you to our educators, our principals, our school staff, and all of our staff across DOE, because those are the folks that were able to make that happen within a week. And we were really happy to be able to launch that as of last Monday. I've heard some really great stories, similarly to what you referenced, about students who are engaging with their instructors and their teachers who are using Zoom and other sort of video platforms to engage directly with the classes and to teach. And so we're really excited that that's happening, and excited that we're able to provide some educational continuity during a time in which there's been a total disruption for most of us in terms of what we go through in our routines on a daily basis. So Also need to thank our parents, because the learning curve for our parents has also been tremendous. I am a parent who is overseeing remote learning for 2 students, and there's a lot of learning that has to happen on the parent side of things, just to be able to figure out how to help the children, especially if they're young children, access Google Classrooms, sign on to these different remote platforms, and then just sort of the regular support that's needed, especially for our younger students, to go through the materials and complete the assignments. But that's happening, and we're really proud of that, and to be able to offer that to our families. So I want to run through some of the other things that are happening, our top priorities, because we've got a lot going on to serve our families during this time, if I may.
Yes, please.
Okay. We know that there are a lot of students who need electronic devices in order to access remote learning, and so we're distributing 300,000 internet-ready iPads to students over the next several weeks. So last week we began.
Wait, hold on. What do you mean by internet ready?
I mean, they are programmed with T-Mobile, through T-Mobile for internet. So the students will get these iPads and they will immediately have access to the internet. So they don't.
So if they don't have internet in their homes, they can still have it on their tablet.
Correct. Yes.
Wow. Okay.
Like a monumental sort of breakthrough for us, because we gave students around 175,000 devices through schools before we began the remote learning. But we got a lot of feedback from families who were having trouble accessing the internet, because you still would have to have internet service in order to access remote learning. So this was a huge breakthrough. I mean, we're really happy to be able to offer that to families. And if families need an electronic device, they can still sign up at www.schools.nyc.gov, and they can submit an online request to receive one of these internet-ready iPads. Last week, we started distributing the iPads to students in temporary housing, to students in youth shelters and foster care. And then starting this week, we are delivering to high school students. We're focusing on our multilingual learners, our students with disabilities, and our students who live in public housing. And so that's going to be happening this week, and then in subsequent weeks. We're getting roughly 50,000 iPads on a rolling basis until we hit 1,000. So that's been a huge sort of endeavor, but we are doing it. For our students who are signed up but they haven't yet received those iPads, we are mailing out packets for kids that are from kindergarten through 5th grade. So we recognize that we've got 175,000 requests so far for iPads. And so we know there are a lot of families who just need to have this academic material for their students. And so we're mailing out packets of curriculum for those kids until they get their iPads and can access the they can access the remote learning. I want to remind everyone that we have grab and go meals at our meal hubs across the city. So we have close to over 400 meal hubs across the city. We are partnering with DoorDash to make sure that we're serving literally door-to-door delivery for our medically fragile students. And so if families need to know how to get access to meals, they can text food or comida to 877-877, or they can visit our website and there's a location tool where they can look up the meal hub nearest to them. And finally, we have our regional enrichment centers, which we also launched last week. We launched those for our first responders, our transit workers, our healthcare workers, and we've expanded enrollment for other essential employees to make sure that there's childcare available for them as they go to provide the essential services that we need during this time. And so families can access the enrollment form online, again, at our website, www.schools.nyc.gov, and we are prioritizing enrollment for our essential workers. So that's pretty much the top line of what's happening within the DOE. Happy to answer any questions you may have.
So basic question, how were you guys able to train the teachers in such a short period of time? What did that look like?
We are just lucky that we have the best teaching force in the country. I think I'm obviously a little biased, but our teachers came in. They came in before remote learning started, and they spent a few days really learning all the virtual learning tools and the online platforms, and they've supported one another. We've had some really great principals who are supportive of their teaching community, and we've really come together, I think, as an agency and as a learning community to both promote adult learning, which is essentially what that is for a lot of our teachers who had to learn how to access Google and learn how to take videos and upload videos and use Zoom, all these different things in order to launch this. And they did it, and we're proud of them.
Look, so with such a big disruption with basically everything and how we do everything, but definitely with education. Do you think that this is helping us, that this process is helping our system and helping our kids with this distance learning?
I mean, look, at the end of the day, the traditional educational model that we have, which is students coming in and having the social interaction with one another, and then having a teacher that's in the front of the classroom that can provide that personal touch and sort of the social emotional piece of what happens within our school communities. There's no replacement for that, right? That's something that's essential. That's something that's incredibly valuable. But what this is a response to a crisis and making sure that there's educational continuity where we can't have that. So it's definitely an opportunity for all of our students who don't normally have access to technology in this way to now have that vehicle, to have that access, and to be learning technology in a different way. And for all of us as adults to learn how to incorporate technology into education in a different way. But it's certainly not a replacement for what we normally provide. It's not quite the same.
One thing is, it's so, now when school is supposed to, I think, we said that, I think the mayor said that they had a tentative reopen date of April 20th, I believe.
Yeah.
But if that doesn't happen, what are we going to do with graduations and things like that? What do you any idea what we're going to do and how we're going to deal with that?
These are the big questions that a lot of, obviously families have, parents have, students have, what's going to happen. And we are in a wait and see moment with this epidemic. We know that we've heard from the medical experts who say, we are in the midst of this crisis. We may not have reached the the apex of the crisis. We don't know when or if that's going to happen. And so we're waiting and sort of waiting with making major decisions until we're further along in this stretch. I take comfort as a parent in knowing this is not a New York City problem. It's not a New York State problem. It is a national problem. There's 46 out of 50 states have closed their schools. There's like over 54 million children across this country who are literally at home. And I'm just proud that our kids are getting some educational continuity. We have remote learning. They're getting instruction. They're getting that consistency in New York City. And so that's what we can do.
Now, Deputy Chancellor, I've heard from some of my siblings, from parents, that parents realize how hard it is to be a teacher, right? Now that they have these kids, have you seen with the interaction between parents and teachers during this process? Because parents, depending on the grade of the child, has to be involved in this distance learning. What have you heard or seen?
I mean, I can absolutely say, if not before, definitely now, parents are appreciating the hard work that teachers do every day in their classrooms. And we are having it, for those of us that have children at home, we maybe have 1 or 2 or 5, but we don't have a classroom full. And so, we're getting a taste of what our teachers do and how complicated and difficult that work is, and appreciating it. And I'm sure, at least speaking for myself, my kids' teachers are phenomenal, and I miss them.
So Deputy Chancellor, I have, so now, all right, so there's distance learning. The scholars are in the home now. Should parents have a schedule for them that goes even beyond the distance learning? Should they create a structure that's like the school day or something different than that? Around the day, you right? These young people were used to a schedule from let's say 8 to 2, or what have you. But now that they're at home, should parents create a kind of structure even beyond the time when they're in front of that screen?
Certainly, there's an opportunity for parents to definitely, access additional resources if they've got students who are eager and sort of hungry for more. Every school has provided a sort of guideline for parents and some expectations around what scheduling should look like and assignments and that sort of thing. So I would definitely suggest that parents consult with the teachers around, what's healthy, what's, going too far in terms of supporting students, particularly during this time because of the context of the education that's happening now and the fact that we're in the middle of a crisis and a lot of students that's weighing on them as well. So we don't want to stress out students any further. But I know at least for my children, there's a lot of online resources available on our website. So I definitely encourage families, check out the website. I know National Geographic has a really great online resource. Khan Academy has a really great Imagineer sort of program for kids. There's all sorts of free online resources that parents should take advantage of if they have the time and if their children are up for it.
So what's the DOE website where they can get the resources? What is the DOE website?
Yes, it's www.schools.nyc.gov. And there are tons of resources from tutorials for parents on how to access remote learning or how to use your Apple iPad, all the way to, you know, if you're a parent of a multilingual learner or you need instructional materials in a different language, that's online. There's a ton of rich materials there.
So here's a question about PE, physical education. Should parents include that with the kids? Should parents make their kids or have some time for their kids to go and do something physical?
I mean, that can never, you know, that can never hurt, right? It's always good for all of us, not just our students, but adults as well, to have physical, you know, movement and build that into the day. I know a lot of our teachers are embedding that into the curriculum. So if parents are going to Google Classroom and the physical education teacher, you know, uploaded materials. I know there's like YouTube videos that sometimes the physical education teachers will upload for kids, which are like, you know, 15 minutes or, you know, 20 minutes worth of exercises or activities that students can do. So I would definitely suggest, you know, for students to work with their schools to access that material. And it's always a great idea to move around, so.
Now, one of the things that's important too is, you know, I was telling folks too, is the interaction that for the students to have amongst each other and between each other. With these platforms, are they able to see each other even while they're learning?
So first, I think that the kids, the young folks, are definitely more adept at social digital interactions than, like, say, I am in my generation. So these kids have Instagram and they've got, I can't even tell you all of the different social tools that they have to do online connections. But that's also embedded within Google Classroom. So there's Google Hangouts, there's Google Chats, there's all these different features within the platforms. And the teachers are doing that as well. I know I've seen teachers who have Zoom and they're using Zoom to have all the children participate in lessons with one another. So it's happening.
Good, good, good. So look, we're very excited about what DOE has and what you guys are doing, where we are. And I just have to say, you know, on the state level, just seeing how you guys have stepped up to the plate and really the level of academics and instruction and support is you know, I'm so proud of what we're doing in New York City. And I'm so proud of what everyone is doing from the bottom to the top and the top to the bottom. So we're really excited about that. One of the things I got too was I got a question from one of the parents that asked if a parent you know wants to add more to their child's to their child's homework or their child's instructions, you know, should they do that, and how can they get that done? How do they do that? So I guess what they're trying to say is, if they want to give the kid more work, how do they do that? And should they contact the teacher, or should they work with the teacher?
I mean, there's always the parental prerogative, right? Like, I'm a parent, you get the homework assignments, you get the projects, and sometimes as a parent you say, it's important for my child to participate in extracurricular resources and maybe take additional classes on the weekend, take a dance class, take a Lego robotics class, whatever it is. And certainly that doesn't end now. So if parents are interested in making sure their children have access to other educational opportunities or resources, parents can take advantage of that. They always can do that. And they probably should do that because, you know, it's a great thing for our students to plug into different outlets and to learn.
One thing that was interesting to me, I still find very fascinating, is that with the distance learning that you guys have implemented, I thought that was going to be for the higher grades, middle school and up, but you guys went all the way down to pre-K actually. What's the challenge with the, or is there any challenge with the young ones?
I'm sure that there's a challenge. You know, that's a good question for some of the pre-K teachers and a good sort of question for them because they're the ones who are really putting the work of figuring out how to engage those young kids and those young students. But you know, they're doing it and it's happening. It's happening in partnership with parents because you have to have parents who are also supporting on the other end and making sure that the students are, you know, showing up for those lessons and they're accessing the material and but it's happening and it's happening through that partnership.
So Deputy Chancellor, now we know about the distance learning, you know, from the pedagogical, you know, teaching, you know, teacher to students. What about the communication and the communications between the administration and DOE and the teachers between the teachers? How does that work? How is that happening? We never talk about that.
Well, obviously we're a complicated sort of, I mean, to, you know, use that word, but we're a huge institution. And so with 80,000 teachers and 150,000 employees, there are a number of systems for sort of getting the word out. There are, you know, weekly communication systems and emails that are going out from central, from different divisions out to teaching staff and to schools. And certainly, you know, schools are very organized. Sometimes they have their own systems of communication. And so we are being very proactive and we are, you know, getting out messages as widely as we can and as often as we can so that everyone is on the same page.
Listen, we have to cut this short because I have to head to budget. I think we're headed back to session. But, you know, Deputy Chancellor Austin, do you have any final words to our parents that are watching and going through this process and that are, you know, that are really engaged with, you know, what's going on with the Department of Education and any resources that they can contact? You already gave a website, but any more?
Certainly parents can always reach out to the Office of Family and Community Empowerment and go to our website to do that because there's a series of different emails there, but it's they can reach out to me directly if they have questions. And I guess my sort of last message is just a big thank you. Thank you to our parents for being our partners in this process, being patient with us because obviously this is a very difficult, monumental program to launch and get off the ground. So just thank you. And thank you to our teachers and our principals and our school staff that are working really hard to make this successful and to have as little disruption as we can for our students and make sure that they're getting that educational continuity. So thank you. And thank you to you for hosting this.
Oh, thanks a million. And Dr. Rosen, I see you still with us. Dr. Rosen, thank you for all that you do.
Thank you, and thanks for having us here today.
Aaron, thank you for hosting. Thank you for putting this together. I have to, you know, I thank my staff for putting this together, and everyone, thank you for watching. If you have more questions, you know, just send it. You can send it directly to me on Facebook or on my email. And if you have, you know, direct questions for the DOE, we can get to the Deputy Chancellor, who is, you know, very engaged, and she's been, you know, she'll answer any of your questions. If you have any questions directly about COVID and New York City's response, Dr. Rosen is a great resource also. Thank you, everybody. Thanks for watching.
Thank you.